Myself, Namrata Prajapati. I will be going to brief you on blood circulation through heart. Before starting, we'll just learn some terminologies. Cardio means heart, vascular means vessels that circulate the blood, and oxygenated and deoxygenated means high level of oxygen and low level of oxygen respectively. So, in circulatory system, the blood circulates throughout the body, passing through the heart for oxygenation. It is a type of closed system. It comprises of heart and blood vessels. So, I'll just brief on heart or the structure of heart before the circulation. So, heart is situated over the left side of the body. It is located behind the sternum between the two lungs. It is a four-chambered muscular organ. It pumps the blood throughout the body. It receives the deoxygenated blood through the veins, while it pumps the oxygenated blood through the arteries. So now we'll see the chambers. The upper two chambers are termed as atrium, right atrium and left atrium. The lower two chambers are termed as ventricles, right ventricle and left ventricle. This is termed as right side of the heart and this is termed as left side of the heart. The right side and left side of the heart are divided by a layer which is termed as septum. This layer prevents the mixing of the oxygenated and deoxygenated blood. Now talking about the valves. We have total two categories of valves present here. One is AV valves, that is atrioventricular valve. Atrioventricular valves are tricuspid valve and mitral valve. Tricuspid valve is present between the right atrium and right ventricle, and mitral valve is present between the left atrium and left ventricle. The alternative name of mitral valve is bicuspid valve. As the name is given, bicuspid, it comprises of two cusps, and tricuspid, it comprises of three cusps. Here, as we told earlier, it is a muscular organ. So, the ventricles, the walls of the ventricles are thicker as compared to the atrium. Now we'll do the circulation of blood through the heart. This is superior vena cava and inferior vena cava. The deoxygenated blood from the body through superior and inferior vena cava enters into the right atrium. The deoxygenated blood from the upper part of the body, that is head, neck and upper extremities, are passing through the superior vena cava, while the deoxygenated blood from the lower part of the body, that means trunk and lower extremity, passes through the inferior vena cava. From the vena cavas, the deoxygenated blood enters into the right atrium. From the right atrium, it enters into the right ventricle via tricuspid valve when there occurs contraction of the right atrium. After opening of this valve, the blood enters into the right ventricle. Then the next stage starts. The right ventricle causes pressure, increase in the pressure which causes contraction. Due to the contraction, the blood travels into the pulmonary artery via semilunar valve. This valve is termed as pulmonary valve. From the pulmonary artery, the blood enters into the lungs for purification, that is oxygenation. From the lungs, it enters back into the heart via pulmonary veins. So, the pulmonary veins carry oxygenated blood from the lungs to the left atrium. When the pressure of the left atrium increases, there occurs contraction of the left atrium and the blood enters into the left ventricle by opening of the mitral valve, that is AV valve. By the opening of this valve, the blood enters into the left ventricle where the pressure increases. The contraction of the left ventricle causes the gush of blood to flow into the aorta via the opening of the aortic valve, that is semilunar valve. From the aorta, the oxygenated blood passes throughout the body. So, this was the blood circulation of the heart. Now, we'll just brief it out quickly. From superior and inferior vena cava, it enters into the right atrium to the right ventricle via tricuspid valve. From the right ventricle, it enters into the pulmonary artery via pulmonary valve. From pulmonary artery, it enters into the lung for purification, that is oxygenation of the blood. From the lungs, it enters into the left atrium to the right ventricle. From the right ventricle, it enters into the aorta. From the aorta, it travels to other parts of the body. So, this is the oxygenated blood.